I remember when there was a time when I was talking to my friend. He is diagnosed with schizophrenia. Interesting, right? I've never met someone who actually experienced psychosis in their daily life. So we were actually talking at 12, 1 in the morning, 1 a.m., basically just talking about life. He was actually mentioning it in detail about Karl Marx manifesto. I did not know a thing about that until he told me about what were his manifestations and all the heavy stuff. And there was a time when I was actually sitting quietly, not talking, and then I didn't ask him any question, but he kept on answering, "Oh, what?" He was like, "What? Oh, yeah, no." Turns out he just didn't take his meds that day. So, what is psychological disorder? Psychological disorder is a condition characterized by abnormal thoughts, feelings, and behaviors. Psychopathology is the study of psychological disorders, and psychological disorders, which is also referred to as mental illness, mental disorders, are abnormalities of the mind. So the result is persistent behavior patterns that can seriously affect your day-to-day function and life. So multiple psychological disorders may exist in one person. Yes. So the specific causes of psychological disorders are not known. When a person experiences mood or cognitive problems or behavioral issues for a long time, a psychological evaluation may be beneficial. A screening may be beneficial for them. Treatment frequently involves psychotherapy, of course. And according to the American Psychiatric Association, APA, 2013, a psychological disorder is a condition that is said to consist these followings, which is there are significant disturbance in thoughts, feelings, and behaviors, and then the disturbance reflects some kind of biological, psychological, or developmental dysfunction in their brains, and the disturbance lead to significant distress or disability in one's life, and the disturbance do not reflect expected or culturally or approved behaviors and responses to certain events. So properly treated people who have psychological disorders often improve, they can get better. However, relapses, downfalls are possible. If left untreated, some psychological problems can lead to academic, legal, social, and work problems. So what are the types of mental health disorders? The common ones, mental health disorders occur in a variety of forms. Sometimes the symptoms can overlap, making disorders hard to diagnose. It's like, the princess and the pea. When there's so many mattresses, you'd never expect that there's a pea underneath. So, however, some common disorders that affect people of all age, many of them, these are some of them. Firstly is ADHD, attention deficit hyperactivity disorder. And then hyperactivity disorder is characterized by an inability to remain still, to focus on a task, and they have impulsive behaviors, and they are prone to excessive activities. They can't sit still. It is said that this disorder is commonly diagnosed in children, but to be very honest, it can also still occur as adults. And the next one is anxiety or panic disorders. Anxiety disorder is defined by repeated attacks of intense fear. You have a gut feeling that something bad is about to happen. You have a sense of an impending doom. The next one is bipolar disorder. Bipolar disorder causes a cycle of emotional states between manic and depressive phases. Manic phases contain periods of extreme activity. Your emotions are heightened, whereas the depressive phases are often characterized as lethargy, sadness, fatigue. Then these cycles they don't usually occur instantly. The next one is depression. Depression covers a wide range of conditions, and typically it is defined by a persistent bad mood, lack of interest, lethargy, fatigue. Yes, and dysthymia is a milder but a longer lasting form of depression. And the last one is the one that I mentioned before is schizophrenia. Schizophrenia is not as commonly taught. Not many people know about this, but it is solely hearing voices. You experience multiple personalities. There's a lack of ability to distinguish which is reality and which is made up illusion, and it causes paranoia, and you there's a belief in certain conspiracies. So the next one is, what are the symptoms of psychological disorders? Symptoms of psychological disorders vary based on the specific disorder, but usually it is mood and behavioral symptoms. And symptoms can be very chronic, and like I said before, it is a season of episode. You can always relapse, and they can interfere with your ability to interact with people, with society. Some psychological disorders also cause physical symptoms. Some of the common symptoms of psychological disorders are agitation, irritability, hostility, aggression, substance abuse, energy levels heightened and lowered, the alteration, anxiety, disconnectedness, confusion, erratic behaviors, perception, or what I mentioned just now is psychosis, where your thoughts and perceptions are altered, hallucinations, delusions, abrupt mood changes that can interfere with your daily activities, and social withdrawal. And these are some of the physical symptoms that may accompany psychological disorders. First is lethargy, insomnia, which is sleep disturbance, weight and appetite alterations, changes, and many more. Serious symptoms that might indicate a life-threatening condition in some cases where it involves psychological disorders. If this happens, please seek immediate help. Please seek immediate care. If you or anyone you are very close with, someone you care about, experiences these life-threatening symptoms. Firstly, it is that person is a danger to oneself or others, where they threaten people, where they are very irrational, where they have very clear suicidal behaviors, and they are unable to care for one's basic needs. They have traumas, physical traumas on the bones, deformity, burns, eye injury, and many other types of injuries. Okay, the next one is, what causes psychological disorders? The causes of psychological disorders are not known, but a number of factors are thought to influence their development. These factors usually include chemical imbalances in their head, hormone imbalances, childhood experiences, past traumas, heredity, prenatal exposures, stress, and sometimes gender role do play a part, but not all psychological disorders. The next one is, what are the risk factors for psychological disorders? There's a number of factors increase the risk of developing psychological disorders. Not many people with risk factors will get psychological disorders, but risk factors of psychological disorders include abuse or neglect as a child, childhood problems with temperament, family or personal history of mental illnesses, substance abuse, including oneself or maybe another party in their family, intelligence below normal, low IQ, low birth weight, low socioeconomical status, parents not being present, parent absence, criminal activity, or prenatal exposures such as to alcohol or drugs. You know, sometimes significant medical conditions such as cancer, chronic pain, and hyperthyroidism, social disadvantage, stressful or traumatic life events. Yes, all of those are one of the risk factors for getting psychological disorders. So, how are we supposed to treat psychological disorders? The first step in the treatment of psychological disorders is recognizing that the problem exists. Do not invalidate your problems. Do not gaslight yourself. Often people who have psychological disorders deny their problems. They do not want to seek medical help. They do not want to seek for medical care for their symptoms. And actually regular medical care can be very helpful because it allows a professional, a healthcare professional, a medical professional to provide early screening tests, to provide early prevention, provide opportunity for your health care professional to evaluate your symptoms and your risk to develop the psychological disorders. One of the many common psychological disorder treatments is anti-anxiety medication, antidepressant medication, to improve your mood, to improve your hormonal imbalances, chemical imbalances in your head, antipsychotic medications, which my friend took for his schizophrenia, which to treat his disordered thoughts and patterns and altered perceptions, cognitive behavioral therapy to work on his thought patterns and behaviors, family therapy, hospitalization, to help them coexist the medical problems, the serious complication, the severe psychological disorders. Identify the problem and have treatment to coexist with the condition, mood stabilizing medication, support groups, and another alternative is talk therapy. So these are the main points that is involved in understanding psychological disorders.